Everyone, Sandeep here from BAM Talks. Today I'll be speaking to a lovely lady called Deepika and we will be talking about mental health in lockdown.
Hi everyone, so my name is Devika Patel and I am a doctor training in psychiatry. So that means that I'm a fully medically qualified doctor, but I chose to specialise in mental health. So I'm also known as a psychiatrist, which is slightly different to a psychologist, so we can have a little chat about that today as well. And Sandeep has kindly invited me on today to talk about mental health during the pandemic, which has been kind of the talk of the town, but it's good to have a bit of an informal chat about it and see what people's thoughts are and what kind of expertise I can shed on this topic as well.
No, definitely. Thank you for that lovely introduction. So we just wanted to start off talking about kind of the effect the lockdown has had on pretty much everybody. I mean, I know I've been feeling very like strange, things aren't normal routine, it feels very weird, and when I've spoken to people, the general kind of feeling has been that it's very normal and everybody's kind of going through it. So I just want to start off on that, to be honest.
Yeah, so you're right, it has affected everyone. I don't think there could be anyone in the world that could say that they haven't been affected by what's going on right now, and that puts us in a very unique situation in kind of history, because there hasn't been a time where everyone together has been feeling the same way about something that has made them feel threatened for their health and their safety, for either themselves or their family. And so the big thing here is that it was an unexpected change and an adjustment to everyone's life that came out of the blue, and it meant that it affected every aspect of their life. Now, usually in our lives, we go through change and that's normal, but they might be a bit more expected. For example, even marriage is a change, even though it's a happy one. There's adjustment and compromise, moving house, even that everyone's very happy about, but it's actually listed as one of the most stressful events that someone will go through in a life. So like that, we do go through a lot of stressful and moments of change in our life, but this was different in that it affected everyone to a very extreme degree, and it affected every part of their life. So their family life, their social life, their plans, which had to all just be cancelled. So whether it was weddings, holidays, plans to move on to a new job, and especially affected those in employment, how they functioned in their job, whether it meant that they were made redundant or they were put on furlough, they didn't have a structure, or they were working from home, which meant either their workload was really high or reduced, or they were managing homeschooling their children and working. So it was a massive change in all aspects of their life. So I don't think there could have been any aspect of their life that remained the same, that had any kind of normality to it. So I think that's why it's had such an impact on everyone's mental health. And like you said, everyone felt that way. And it's an absolutely normal reaction to be anxious or to feel low in mood about that, for it to affect your sleep pattern, your appetite, your energy levels, your motivation, and that's absolutely normal. So if you have been feeling like this during the lockdown, I think the best thing to do is to talk to other people about how you're feeling, but then also try to take some steps to see what you can change. And we'll talk a little bit more about that as we go through.
Yeah.
So when we do think about the impact of mental health, like I've mentioned, is you can think of it as a spectrum. Different people have been affected in different ways. It also is going to be affected by if you already had a mental health condition or not. So it might have affected you more severely. It might have meant that you had a relapse of that condition. But saying that, this event has been so kind of extreme and such a drastic change, I've also seen people in my service, so my day-to-day job, that people that have had no history of mental health illnesses suddenly having a very severe mental illness, for example, a severe episode of depression or an acute psychotic episode, which people might know as like a mental breakdown. They might require hospitalization. And there's also been reports of suicide. So people that have not been able to even get mental health support, that have ended up ending their life because of all the things that have been happening. And it could have been they've lost a loved one very unexpectedly, or just changes in their social or financial situation. So it's affected everyone, but at different degrees. So it could have been their mood, anxiety, sleep that was affected. But when those changes become sustained and there isn't anything done to kind of help you get out of that, where it's your low mood or it's your anxious mood, then that has the potential to turn into a diagnosable mental health condition, which needs kind of treatment and support, psychological help, and that's how it can affect people. So they can develop mental health illnesses or have a relapse of their existing conditions, which needs extra support. So that's kind of in a nutshell how it might have affected people's mental health, going on a massive scale of mild changes to their mental health or severe kind of enduring changes to their mental health as well. But it's I would confidently say that everyone has been affected in their mental health, and maybe it's made them actually more aware of their mental health as well, which is really good, because they see everyone going through the same thing, so they can actually relate to people and talk to people about it. Whereas before, if you're kind of going through your own problems, you might be able to not talk about them or kind of brush over them, not give them any attention, not think about, oh, what should I be doing to keep myself healthy from a mental health point of view. So I'm really glad that we could all kind of come together as a society, as community, as families, as friends, to talk about our mental health and talk about the impact that this has had on us, but also then to remember that our mental health will still be there after the pandemic is over, even when everything returns back to the new normal. And we need to keep in check with it, because I think that's probably what generations have forgotten about over the years, that mental health has slowly taken a back seat. Whereas if we look back to our kind of our ancestors' mental health and spirituality, all of that was kind of integral to our being.
Yeah. No, 100%. I was literally going to talk about that point as well. The fact that as soon as we went into lockdown, it was the thing that kind of was most spoken about. The fact that a lot of people are feeling very down. It's a new way of living. People have got to adjust and all this, that and the other. But when you actually sit down and you think, actually, we're all going through the same thing, and being able to acknowledge that, I feel like before it was a lot easier for people to actually, like you're saying, brush over it and just be like, oh, I'm feeling a bit down, that's it. Whereas now we're really like, we're at home and we're having that time to reflect and really think, actually, there's more to it, and there's actually more I can do as well.
Yeah.
So I think it's definitely given us that time we needed to look at our own mental health as well. So the second question I have for you is, how actually can you then help yourself if you're in a situation where you feel low, you feel depressed, you feel suicidal? What are the actual kind of go-to points that we can do?
Yeah. So that's a really important question. But what I'm going to do is I'm going to take it a step back. So hopefully what people have now learned is that there are lots of steps that we can take before we get to that point. So I'm just going to talk through a few techniques that you could be doing to manage your mental health before you even get to that stage, but then also give you the advice of what to do when you find yourself in that situation. So let's kind of take the example of keeping fit from a physical point of view. So you won't wait until you're obese, overweight, got diabetes, until you decide that you're going to start going to the gym. Like most conscientious, healthy people are thinking, well, I need to go to the gym to stay fit. Even if they're slim and slender, they'll still go because they say it's good for my physical health. So like that, even if we aren't experiencing any mental health difficulties, we need to acknowledge that we have mental health, like we have physical health. So we need to start thinking about ways to make sure that we incorporate mental well-being into our everyday life, because I think we've been in this rat race, and that's how kind of the world has been going in this fast way, just to get things done the quickest way, the speediest way, work all hours of the day. And we've not had a chance to reflect. But this time, when the whole world almost shut down, was a time to think about your priorities. And the number one priority is our health. So that's where we've got to begin. What are you doing for your mental well-being on a day-to-day basis? What I would suggest is you think of 3 very simple things that you're going to integrate into your kind of weekly schedule or daily schedule that's going to be helping with your mental well-being. I'll give you an example of what I've done. So I've tried to improve my sleep hygiene. So I'm trying to get to sleep at a certain time, make sure that the lights are dim before I go to bed, not trying to use my phone for 1 hour before I go to bed. All those kind of very simple things that are massively overlooked, because like 90% of people are scrolling on their phone before they fall asleep. So all these simple things, that's going to massively affect how good my sleep is, and then affect my mood for the rest of the day as well. So that's the one thing I'm doing. I've also got back into reading. Like, this is something that I used to love as a child, and as I've got older, I've kind of thought, well, if I'm going to read, it's better if I read a textbook, which is really sad because it takes away the enjoyment of reading. But I've got back into fiction reading, and I'm really enjoying that, and that's part of my bedtime routine as well. So I'll read for about half an hour before I go to bed, or about half an hour on the weekends when I've got spare time. So again, that's giving me some time just to concentrate on me, where there's no other distractions, and I'm able to just kind of get into a book and really experience something that I find enjoyable from the comfort of my home. And then the other thing I've started doing, but slightly slipped off, I'll be honest, is trying to do some daily physical exercise, and the aim of that being my mental well-being rather than my physical well-being. And I found that once I changed the purpose of that physical exercise, it actually made it more enjoyable. So rather than trying to work out for the aesthetics, which I think everyone kind of does to a certain point of view, just because of the way that society is and the way body image is seen. But when I started thinking that actually when I do that jog, I feel 10 times better in my mood, it actually made me more motivated to go for that jog, rather than thinking, well, I've gone for that jog, but I'm still out of breath. So the aim became to lift my mood, and it really did help, because I was off work for 3 weeks because my husband had COVID, so I was self-isolating, and that was the way that I got through those times of being at home, not having any contact with family. Going on those jogs, it really helped me clear my mind. And that physical exercise just released those endorphins, which is the happy hormone, and kept me going. So those were my 3 things. Now the hard part is for me to keep this up when I still go back into my busy work schedule. I've kept up with the reading and the improving sleep. The physical exercise has slightly gone down the drain, but that's, again, something that you need to keep working at, and then eventually it becomes a habit. The other thing to do is to really, the art of mindfulness is the best way to manage your mental health. People sometimes find mindfulness quite difficult, but there's lots of apps that can help you through it. But basically, the essence of mindfulness is that you become more aware of your physical body and all the different changes that are happening. So the more I do mindfulness, the more I can sense when I'm getting anxious. So rather than I'm at the point of severe anxiety and I can't control it, I can feel my heart racing, or I can feel my palms are getting slightly sweaty. I can feel my stomach feels like it's got butterflies. And that will be a whole half an hour before I'm feeling absolutely struck with anxiety. What that does, it just makes you more aware of your body, and you know what you're feeling. And I think even the way we use our words, we have totally forgot about the way we are feeling, because we have automatic responses. When someone asks you, how are you doing? Automatically you say, I'm fine. And maybe we start doing that with ourselves as well. So you're just telling yourself, I'm fine. But really, you need to be constantly keeping a check on your body. And the only way to do that is to live in the present moment. And that's what mindfulness is all about. So by practicing the art of mindfulness, you'll be able to tell when your mental well-being is going a bit off, when you're having a bit of a wobble. And you might notice it as your sleep going off, your mood being a bit low, not having enough energy, not enjoying things, not having the motivation. And that's when you need to have a plan of 3 more things that you're going to integrate into your plan on top of what you're already doing to help you get better. And that might mean speaking to someone about it. It might mean increasing kind of your mindfulness exercises that are particularly for low mood or anxiety, or doing something targeted that will help you feel better, or positive affirmations, whatever it is that you find that's going to help you. But then you also need to set yourself a kind of timeline to say, within 2 weeks, I'm going to do all of this. And if it doesn't get better, then I need to do something. And that brings me nicely onto your question, Sandy, what to do when you've tried everything you can, but you're still not feeling in a right place, you're not feeling safe, you might be having suicidal thoughts, which you're finding really difficult to control, and you're just not managing, you're not functioning, every part of your life is kind of not at the best it should be. And that's when you have to go to your GP. That's going to be your best way to seek some help. The GP can do a few things, and I'm going to be absolutely realistic with about how GP works. So the quickest thing that they can do is start you on some medication. That could be for your depression, your anxiety, or if it's more serious, like a psychotic episode, then they will refer you to a specialist team. If we just concentrate on anxiety and depression, because that's more common, so they can prescribe you some antidepressants or some medication to help calm you down. What that's going to do is kind of kickstart your recovery, so it will cause a change in the chemicals in your brain. So it increases something called serotonin in your brain, which is low with depression, and that will help you feel a bit happier and kind of get you back into your routine. However, the other thing that you need to be thinking about is psychological help as well, because that's kind of the long-term benefits. Now, the waiting list for psychology is very long on the NHS. However, you can consider getting a private psychologist and getting therapies, or there is also kind of a low-level psychological help that's available on the NHS, and it's much easier to access. So it might be a counsellor that you talk to, or it might be someone that knows something called CBT, which is cognitive behavioural therapy. Or the other thing is you can actually do CBT online, so you can work through some modules. So rather than having someone go through it with you, you have the option of doing it yourself, and obviously that you can access whenever you want in your own time, don't have to go to appointments, and with COVID kind of stopping all face-to-face appointments, it won't be affected by that as well. So there's a few options that the GP can present to you at that point. And what I would say is at that time, you still need to be doing those 3 things that you were doing before, and the 3 extra things that you did to make your mood better, because it's not just the medication and psychology, but it's also all the extra things that makes you feel better that are going to get you back to your kind of final recovery stage. Obviously, if you think that you can't wait to speak to your GP, for example, it's the middle of the night, out of hours, the weekend, then you need to consider speaking to the Samaritans that are a really good 24/7 helpline that can help you talk through how you're feeling. And if they feel worried about you, they can get an ambulance to come to you to talk you through how you're feeling if it's an emergency. And that's how people access help. And I'm not sure everyone knows that this is how to access help, unfortunately. So they might actually suffer in silence for months and months and months until actually going to the GP, where the depression is much worse. Yeah. I like to give the analogy of kind of, let's say you've sprained your foot. Now, what you wouldn't do is say, well, if I just jog on it harder, I'll get better. So similarly with your mental health, if you're not feeling well, just pushing yourself harder isn't going to automatically make it better. Yeah. What you would do is you'll say, well, I'm going to rest my leg. I'm going to take some paracetamol. I'm going to do a few kind of rehab exercises. And that's the equivalent of taking some time out of work, speaking to your friends and family, giving yourself some time out, tending to your self-care. But then what you would also think about is that, well, actually, if this doesn't get better within 4 weeks, I'm going to see the GP. So if you think about your sprain in that way, you should also be thinking about your brain in that way. It's exactly the same. It's an organ, and it's the organ that makes you you. So it's the most important organ, really. So you should address it in the same way that you think about your physical health. So if things are not getting better, I'm not able to handle it, I need to speak to a specialist that can point me in the right direction, get some more specialist help, and then I can be supported in my recovery from there.
Yeah, no, that completely makes sense. And when we did the BAM talk as well, your analogies just put everything into so much perspective. And it's all the feedback I received after that talk was that actually that idea of having like the headache, you wouldn't ignore it, you would take paracetamol, you would take these certain steps. So why we don't see our mental health in the same way as we do our physical is sometimes really sad, because if we did look at it from the same kind of picture in the same way, we would handle it a lot better. And kind of reaching that actual end point of being in a real bad way when you go to see the GP could have been preventable.
Yes.
In the kind of steps that you could take beforehand. So the other question I was going to ask you is, how can we deal with kind of the changes that have taken place? So cancelled weddings, cancelled holidays, work being made redundant, working from home, all of these different types of things. I know you touched upon routine, but I just wanted to pick at that a little bit more.
So I think one exercise that I do with my patients, and that's if they're going through some change and they're finding it really difficult to manage with it, is we do a writing exercise where we split the change into things I can control and things I can't control. So once you kind of make a list for that, so for example, if we're thinking about a cancelled wedding, because I know so many couples are going through this at the moment, and it is really, really stressful. And every time I see like something about weddings being cancelled, I just really count my blessings, because I got married last year and I just feel so grateful. And I know if I was in that situation, I would find it very, very difficult to manage. So although I'm giving advice on how to manage it, I think I would find it very hard initially to take on the advice as well. So I don't want to kind of downplay how upsetting and traumatic it is to cancel a wedding, but I also want you to give you some kind of tips on how to manage it. So initially, I think what you need to do is let yourself be upset and sad, because it is very sad, and there's no point trying to be like, I'm just going to try to get over this. You just have to let yourself have that time to kind of grieve, because it is a bit of a grieving of a loss, but then also start to think about how you're going to go about it. So if you make a list of the things you can do and then things you can't do. Now, when you make a list of things that you can't control, you need to think that whenever you get a worry about these things, you need to remind yourself, well, this is out of my control. So worrying about it is actually not going to solve any part of it. It's only going to waste my time and energy and my resources, and there's no point in it. Instead, you need to channel all your energy and your resources into the things I can control. So that might be trying to liaise with your suppliers, speak to your family about it. And then after you've kind of done that and you've made sense of where you can go and the things you can control, the other thing is an exercise of gratitude. So to think, well, I know these big changes have happened, but despite them happening, what am I still grateful for? What have I still got? Now, some of my friends work in the actual front line. So during COVID, they've been working in ITU or in A&E, and they've seen 30-year-old patients pass away. So even to say that, well, the truth is, even though my wedding's been cancelled, I've still got my life partner. Even that bit of gratefulness will make you just see the whole situation in a much lighter way. Not to take away from the hurt of it being postponed, but just to think that, well, actually, I'm really glad that I've still got all the people that I love in my life, and I can still do this great celebration, but just at a later date where it's going to be safe for everyone. Because the other thing is, you wouldn't want to do a celebration and the result of your celebration being a few deaths of your family members. That would just be absolutely difficult. But I know in times like this, it's really hard to kind of think about the logic of it. So give yourself time to grieve over it, feel sad about it, that's fine. Share it with your family, and then think about how you're going to move forward, because staying stuck in that rut isn't going to help you, your families, your wedding plans, or anything. So give yourself time, then think about how to move forward. Think about that list, things you can control, can't control, and just keep reminding yourself of that, so you don't stay stuck in that place of, well, it's just really annoying that it got cancelled. I'm really annoyed. Yeah. But I totally understand if you're feeling that way. It's just make that transition from that to, well, I'm glad that my family are happy and healthy and we can do this at a later date. But still, people would have lost family members during this, and it will mean that when they do have their celebrations, certain family members won't be there. And it will be really hard to find the silver lining, but in every situation, there is always, even if it's the smallest silver lining, there will be some silver lining that you can find in a situation.
That's so true. And that's kind of quite a nice way to look at it as well, because I definitely do, like you said, it is like grieving time. And I definitely do think, like, even if it was me in that position, I would have really struggled with it. So to have that time to acknowledge what's happened, I do think is really important. But then just like building up your resilience to overcome it, definitely like speaking to people around you, I think is really helpful. And something that I've actually been doing with one of the BAM girls is that we've been doing daily affirmations every day. And we've both found that it's really, really helped us. So I know that you get lots of like positive affirmation apps and things like that, and they are seriously a lot more helpful than a lot of people will let on. So I definitely do things like that to make the situation a little bit more lighthearted than it is.
Yeah. I think definitely try it before you knock it. If you feel like it's not your thing, you don't know until you try. Even for mindfulness, I'm a big advocate of it. But when I first started it, I was like, I'm not sure if this is my thing, if I can concentrate. And even now, my practice isn't regular. I know that when things get a bit tough, I know exactly where to go to. And because I've got that plan in my mind, it makes it easier rather than being in that situation, being stressed out, feeling anxious, and then trying to think of, oh, what do I do to help my mental health now? It's too hard. You need to have your, what I call a safety plan in place before, so that when you get to that situation, you know how to react.
Got your tools. Yeah, exactly. Like I always used to find writing really helpful. And only as I got older, I like stopped doing that. I didn't really fancy doing it anymore. Started to look into mindfulness. And when I first started, I could not stand it. I was like, I can't concentrate. I'm one of those people who has 10 million things going on in their head at the same time. So I found it really difficult to concentrate. And now, like, headspace is something I bang on about, because I'm like, actually, once you've practiced it a few times, you do get into this space of just like understanding, and like how you're saying, understanding what your body's kind of saying and knowing when that kind of panic is coming along. I think that learning that mindfulness has really helped me personally now, where I will know, okay, I'm starting to get really, my heart is beating so fast, I'm about to start panicking, what can I do? And then immediately I have these little tools that I can use. So to have that 100% is definitely helpful. So the final thing I wanted to kind of talk to you about is how can people actually deal with the lifting of restrictions? I know that I have really bad anxiety, and on a general basis, I don't like people like coming near me, breathing near me, touching me. I'm not one of those people. So going out into like the kind of world now, going back into normal working life and stuff, how can we kind of ease that anxiety a little bit?
That's going to be really hard, because I think everyone has their own stance on where they stand with about kind of going to restaurants and pubs, even though restrictions have been lifted. And I think that's absolutely fine for everyone to make their own judgment. So just because the government has said, okay, it's safe to do so, doesn't mean that you have to go out. And it also doesn't mean that if you choose not to go out, it means that you're an overly anxious person. It's okay. You can choose to not go out because you still don't think that it's safe enough to go out, because the truth is the infection rate is still there. It hasn't been, it's not zero. So there is still the chance of infection. There is still chance of hospitalization. There's still chance of death. The only thing is that it's low now. So I think it's a balance. It's about making sure that when you are deciding not to go out, see as I'm doing it from a safety point of view rather than I'm avoiding that situation because of my anxiety. And there's a clear line between that, and you need to kind of work through it yourself to work out what's the real reason. I know my little sister, she was really struggling with that, and when we spoke about it, it actually came out that it was a real anxiety about all the worst things that could happen. Now, again, this can be a normal reaction, because the truth is, her idea of what the worst thing could happen is that she gets coronavirus and spreads it to my parents. Now, the truth is that's a real thing that could happen. What you have to remember is that risk is slightly reduced than it was before, but it is the reality. So I can't knock her and say that's absolutely like out of this world suggestion, you're being catastrophic and over the top, because she's not. But I think you need to decide on what the small steps are that you're going to take. So if you're deciding not to go to restaurant and pubs, that's absolutely fine, and I think everyone around you should also respect that decision. But make sure you're still going out, go to the parks, go to the shops when it's quiet, so that otherwise what's going to happen is you're going to get so used to staying indoors. You're going to then condition your mind that going out is a scary thing, even when everything is normal. And that's going to be so much more harder. So take small steps, but safe ones. So you can still go to the shops, or do a restaurant booking where you know it's going to be really quiet, or right at the start of evening, so like 5 p.m. So you know that there's not going to be many people there as well, or where you can sit outside. So still try to do as much as it feels safe for you, and don't totally restrict yourself. That's what I would say. But it's a really hard one. I totally understand it.
No, that's a good idea. And one of the other things that actually I've had a lot of messages about on BAM is, how do you kind of deal with this? So at the moment, I feel like we've got a lot of people who believe there's coronavirus, and then we've got a lot of people that believe it's not real. So I feel like there's a lot of conflicting kind of stuff on the internet, but it's making a lot of, like, my followers, definitely a lot of anger. There's a lot of angry people. How can we kind of deal with that?
I think the truth is there's always going to be conspiracy theories, and there's always going to be a split between what people think, and like a divided opinion on stuff. And I think there was, even when we think about like Black Lives Matter, even that, it brought about a lot of anger, and there was a lot of kind of explaining, and then certain groups of people having to say, well, no, it's not about Black lives, it's about all lives matter. And there was that whole debate, and that created a lot of anger as well. So I think what you have to remember is there's always going to be an opposing view. I would say that if you feel comfortable in your viewpoint, and you want to take the risks associated with it. So for example, if you don't think COVID doesn't exist, and it means you're going to walk around without a mask, and you have to, obviously you're going to deal with the risks of that as well. If you think that COVID is real, and therefore you're going to wear a mask and you're going to be safe, then you're doing everything you can within your control to manage your safety. What you can't do is force other people to change their mind or do something else. I think rather than being angry towards them, you need to do whatever's, again, it's going back to things you can control and can't. Do things that you can control and move forward with your life. And if seeing that person on your feed or them popping up in your WhatsApp is annoying you, you need to just block them and kind of discontinue conversation. Because the truth is that opposing view, they're not going to be able to convince you, or you're not going to be able to convince them. So it's not going to be an argument that's going to be solved. So it's better to disengage from that. That's what I would say.
And that's really, really helpful. Thank you for having that conversation with me. It's been really, really nice talking to you.
It's been brilliant for me as well. Thank you, Sandy.
Thank you. See you. I'll speak to you soon.
Bye.
Bye.